Assalamu alaikum. I'm Dr. Muhammad Mohsen. Today I'm going to talk about clinical examination as a part of clinical module skills of MRCS Part B. As we know and as we said before in a previous video that the clinical examination comes as 4 stations in the exam. But from October 2020, there will be only 3 stations. If you want to know more details about this topic, you can return to a previous video. As the Royal College had a notification regarding this issue. These 4 stations have no pattern. What's the meaning by no pattern? Any stations can come. We know that there is about maybe 30 or 30 something stations of clinical examination that came in previous exams. So these examinations are repeated in every exam. So we will discuss these stations in details in coming videos, and from these 30 something stations, any 4 stations can come to you in your exam. So it is 4 stations. It will become 3 stations, okay, from October 2020. Also, you have to know that the same format, it is 10 minutes. These 10 minutes are divided into 1 minute as a stem, 6 minutes with the patient, and 3 minutes with the examiner. The first minute, this is a short stem. He will request you to do examination of the patient regarding something. If the patient, he will say in the stem, the patient came complaining from claudication pain in his right lower limb. Please perform an examination of the right lower limb, or perform an examination, peripheral vascular examination of the patient. Okay, this will be a short stem. Okay, no much data, no much information in the stem. Regarding the 60 minutes, this all 60 minutes you have to perform your examination. The examiner is not allowed to interrupt you or ask you for anything during these 60 minutes. If you finished before 60 minutes, you can tell the examiner that I finished my examination. But before this or before the bell, he is not allowed to interrupt you. Okay, so after the 60 minutes have finished, you have to stop dealing with the patient and stop your examination. And now you have to present your case and then say a differential diagnosis of your case. After that, the examiner will start to ask you about what investigations shall we do for this patient, and what is the treatment. And as you see, it's very tight time. Okay, for you for in 3 minutes to do presentation of the case, and then say a differential diagnosis about the case, and then you will be asked about investigation and treatment. And make sure that you have to be asked, because if the examiner didn't ask you, you will lose the marks of these questions. So if you watched some videos regarding examinations, you will find many videos on YouTube explaining how to examine patient and how to perform examination of some MRCS stations. See, in the exam, we don't perform full clinical examination. Okay, we perform focused examination. You can't perform full clinical examination in the patient. If you want to perform full clinical examination, you may need 60 minutes, 60, not 6 minutes. Okay, so you are not in the clinical practice, you are in an exam. So we have to go through a special technique, which is focused examination. In this focused examination, you have to do some steps in the examination that you will be asked to do. Okay, if you perform it more than you asked to do, you will not get any benefit, but it will be harmful for you, because you will lose your time. Okay, it's time consuming to perform many steps that you will not get any marks regarding them. Okay, so in the coming videos I will let you know which steps in the clinical examination you have to do. And regarding these videos only for clinical method demonstration, not to perform as came in the video. Okay, so this is so important for you to know. The second thing, you are supposed to perform your examination in 6 minutes, but I'll tell you that you have to perform this examination in 4 minutes, not 6 minutes. So some of you will say it's impossible. How could someone to perform a clinical examination in 4 minutes? You can do it, because many of our colleagues and they succeeded to perform that. How could you perform that? How they could perform that? By the following. Number one, you have to know first what to do and what not to do. So this will be explained in details in the next videos during this course. Number two, practice. This is the most important thing, to practice. Without practice, even if you memorize all data and you didn't practice how to do the test, you can't perform the test even in 6 minutes or even in 10 minutes. You have to practice the test. How you practice? You have to get a study partner. This study partner may be your colleague, maybe your friend, maybe somebody who is set for the exam in MRCS Part B, and you know him, and you can get benefit from each other by let him examine you, and you can examine him or do the tests upon him, and vice versa. So this is so important. You have to practice each station at least 5 or 6 times before you enter the exam. You have to perform these clinical tests in your subconscious. If you couldn't reach that, you are still not ready to sit for the exam. So you have to practice, and your practice should be like an exam, timed with a stopwatch. You have to follow your time every test. You have to see now I did the test in 7 minutes. I did the test and I did the clinical examination in 6 minutes. I did the clinical examination in 5 minutes. You have to count your time. Okay, this is so important in your practice. It should be timed like an exam. Number 3, you have to practice also not only the clinical test, but also you have to practice how to present the case. And here I know that you can present the cases as a surgeon, but here you have to practice the presentation of case in a very short time, and here also it is a focused presentation. I found positive data 1 to 3, negative relevant data is 1 to 3, so my differential diagnosis is 1 to 3, like that. So it is focused presentation also, so you have to get familiar with these techniques. You have to know what to do and what not to do. You have to know and practice the clinical examination. You have to practice how to present the case in a focused method. Okay, so regarding these videos on the internet and YouTube, I may leave some links to these videos, and I know that most of them are present in YouTube, but my advice not to try doing like what came in these videos exactly. Just watch the video to know the clinical methods only. Okay. Regarding the assessment of clinical stations, you know that every station has 20 marks. Okay, these 20 marks are assessed by one examiner. In this station, only one examiner. Okay, how he will assess you in this station? In the sheet mark, it is present like that: 12 marks for the clinical examination and 8 marks for the discussion, for your presentation and the discussion with the examiner. But actually, the examiner or most of the examiner don't do like that. What they do, they just watching you. They are watching you during your clinical examination of the patient, how you dealt with the patient, how you did the test. Okay, and after that he will listen to you during your presentation of the case and see what finding did you reach. Okay, what finding did you reach the finding? Did you reach the finding that's supposed you to reach? Because of course the examiner will know what positive finding should be present in this case, and if you told him what you should tell him, so this is right. Okay, if not, so you missed something. So you have to reach the positive finding as should be present in the case. Also, you have to put differential diagnosis correctly. So you have to finding. He will see first. Here we watch examination. Then he will hear what finding did you reach, and then what finding you reached, and then differential diagnosis of the cases, and he will ask you the questions and see your answer. So he will give you the marks collectively according to these elements. Okay, this is regarding the assessment. There is some tips for this station. The first one is that your examination should be in a systematic way. You should be organized and do examination in a systematic way. This is so important. Number two, you should be presentable. During presentation of your case, you should be calm. You should have a good attitude, and you should be presentable when you present your case. and this will come with practice, because you need to practice under the pressure of time, not only how to tell the examiner in a good way, but in a short of time, because the time is very tight here. Okay, and actually many of the finding in this station will be about to be known to everyone, but what differ one to another is the way of presentation, is the way he do the test in an organized way. This is so important, and this will come with practice and practice. Okay, then also most of the cases in the exam will be an actor, because it is difficult to bring real patient in most cases. One of the cases in the exam is cerebellar ataxia due to posterior cranial fossa tumor. So it is difficult to bring patient like that, real patient, but it is simple that he can bring a professional actor, and he can present like he has ataxic gait or something like that. Okay, but in some cases will be a real actor, real patient, like in thyroid, like in swelling somewhere, like in hernia or hydrocele. Okay, so in these cases you may find that there is a real patient. Okay, so this is regarding we need it here. Okay, so this is regarding the type of patient. We will come to the last point, which is something you will do in every station, which is we called wiper. And most of you may know this, and we do it, but you have to make sure that you did these steps before you examine the patient, and after you enter the station. W for wash your hand, and I wash your hand by alcohol gel. You will find bottles for alcohol gel inside the station. I identify yourself, and same in a simple way, I am Dr. Muhammad Mohsen, one of the examination candidates. That's it. And P for permission. Permission, you will gain permission after explanation of the procedure to the patient, and simply you will explain to the patient in a very simple way. I'm going to examine your lower limbs, and I may examine your tummy. That's it. Okay, don't explain in details. I'm going to feel your pulses, feel your temperature, palpate your tummy. Not like that. Okay, just in brief, and after you explain, you will ask him, may I proceed with that? So this is a verbal consent. So B for permission, E for exposure. Exposure, because in the medical field we have to expose what we need from the patient to examine him. So if I'm going to examine lower limbs for possible ischemia, I have to expose the patient abdomen, and I have to expose both lower limbs. So I will ask the patient, may you please expose your tummy and your lower limbs. Okay. Sometimes, and this is very rare, the patient may refuse to do like that, and so simply you just face the examiner and tell him the exposure should be from the patient umbilicus to the feet, but the patient refused, and then complete your examination without any problems. Then after that we come to our repositioning. What's meant by repositioning? Most of the time you will enter the station and you will find the patient lying down on the couch. And in many stations, you should start your examination while the patient is standing. Like in varicose vein station, in varicose vein we start examination of the patient while he is standing. Also in many orthopedic examination, you will ask the patient to stand first, and you examine him and then ask him to walk for a few steps and then lying down. So repositioning means that you put the patient in the perfect position to start your examination. This meant by reposition. So these steps you have to do in all your stations, and don't forget any step from them, because if you forget any step for them, you will pay it for from your marks. Okay, so never forget these steps, and practice them with every patient, and you should do in your clinical practice as part of your daily clinical practice. I hope this highlights just give you an overview for the clinical examination station in MRCS part B. In the next videos we will explain in details these stations that we mentioned, and I hope this can help you in your preparation for the exam. Good luck, and thank you.